Thank you to the Scientific Committee for allowing me to present our work. I would like to acknowledge my co-investigators, Professors Sue McDonald and Richard Gray. I am associated with Mercy Hospital for Women and La Trobe University, and I'm self-funded. I'm honoured to have completed this research on the ancestral lands of the Wurundjeri people of the Kulin Nation. I acknowledge the first Australians as the traditional custodians whose cultures are among the oldest living cultures in human history. I pay respect to the elders of the community, past, present, and emerging. People with low health literacy are known to have an increased number and length of hospitalisations, lower utilisation of preventative healthcare programs, less effective management of chronic disease, increased rates of medication errors, overall poorer health outcomes, and limited ability regarding decision-making compared to people with higher health literacy. The results of a literature search have shown inconsistent results regarding patient satisfaction and its association with health literacy. The study was conducted at 2 metropolitan hospitals in Melbourne, Australia. It involved several urogynecology, physiotherapy, well women's, and pre-admission clinics. Clinicians involved included nurses, doctors, and physiotherapists, and local research ethics committee approval was obtained prior to the study's commencement. The objective of this study was to determine the association between patient satisfaction with clinical consultation and health literacy. Inclusion criteria was any woman aged 18 years or over who spoke English and was attending one of the clinics involved. Women were excluded if they did not provide written consent, used any type of interpreter, or had severe visual or cognitive impairment. Study measures included the rapid estimate of health literacy and Mezzanine Revised, or REALM-R, health literacy test, the Australian Pelvic Floor Questionnaire, and the Short Assessment of Patient Satisfaction, or SAPS questionnaire. There were 3 data collection points: in-person pre-consultation and immediately post-consultation, and by telephone at 1 month. On the day of the scheduled appointment, women were approached and invited to take part using a random sampling method. Immediately prior to the consultation, the REALM-R health literacy test was performed, along with collection of demographic and clinical details and an estimate of subjective knowledge. Using a Likert scale, women were asked, how much knowledge do you have about your condition or treatment? The short assessment of patient satisfaction questionnaire was administered immediately following consultation. This was a cross-sectional observational study with a sample size of 222. Recruitment commenced in September 2018 and was completed in February 2019. All data were entered into a REDCap database and analysed using SPSS. This flowchart shows that 589 women were eligible for the study inclusion, 277 of whom were able to be approached and invited to participate. Of those 277 women, 222 agreed to take part in the study and written consent was obtained. Tables 1 and 2 show the demographic and clinical characteristics of the study participants. Women had an average age of 54 years and had on average had 2 babies. They had attended school on average for 14 years. 18 women had attended primary school only. Almost 2/3 of women were married or living with a partner, and half of the women were engaged in paid work. Health literacy test scores were high, with a mean REALM-R score of 6.95 out of a maximum score of 8. 1/4 of participants failed the REALM-R health literacy test with a score of 6 or less. Following linear regression, a significant association was found between satisfaction with consultation and clinic type, presenting symptom of urgent incontinence, presenting symptom of other, subjective knowledge score immediately following consultation, and subjective knowledge score at 1 month. There was no association between satisfaction with consultation and health literacy, duration of consultation, age, body mass index, highest educational qualification, number of schooling years, or clinician type. We went on to analyse results based on health literacy test pass or fail, shown here in Table 4. Participant age was similar in both health literacy pass and fail groups. Women in the pass group were more likely to have higher education levels and be in paid work than women in the fail group. Women who attended primary school only were more likely to be in the literacy fail group. One participant who had a higher degree failed the health literacy test. Women in both groups attended all selected clinics, consulted with all of the clinicians listed, and both groups had high levels of satisfaction with the consultation. Realm R health literacy test scores were high, with a test pass rate of 75%. Study participants attended all targeted clinics and consulted with a nurse, doctor, or physiotherapist. Satisfaction rates were high regardless of health literacy score, type of clinician, or consultation duration. Subjective knowledge scores were also high, and higher subjective knowledge was associated with higher levels of satisfaction. There were limitations to this study. Participation was limited to women only, and therefore the results are not generalisable to the community as a whole. Participation was limited to English-speaking women who did not use an interpreter, and finally, the study was cross-sectional, not prospective. We conclude, therefore, that patient satisfaction with clinical consultation is not associated with health literacy. Thank you.